Now, both Suboxone and Belbuca are name brand medications that both contain buprenorphine, which is the partial opioid agonist used for either chronic pain or opioid use disorder. Now, however, there are some major differences between the two medications. Number one, the clinical use. Suboxone is the cornerstone medication for treatment in opioid use disorder. We know this. Now, the combination of buprenorphine and naloxone helps to reduce cravings, reduce withdrawal symptoms, and then also blocks the euphoric feeling that comes from other opioids. Belbuca is a little different and is designed for chronic pain management and is also prescribed for patients who require continuous long-term pain relief for where other treatments have actually failed. Even though it contains buprenorphine, unlike Suboxone, it's not intended for the treatment of opioid addiction. The administration is actually fairly similar. Suboxone films or tablets are actually placed under the tongue sublingually, where they dissolve. This route is chosen to enhance the absorption of buprenorphine and ensure that naloxone remains inactive unless it's actually tampered with. Belbuca, it's actually administered as a buccal film or by placing it inside the cheek where it dissolves. This method is used for the controlled release of buprenorphine into the bloodstream for continuous pain management. Now, as spoken before, the dosages are drastically different. The available dosages for Suboxone vary from 2 milligram to 12 milligram tablets or films, and of course are going to be dependent on the patient's current response, their needs at the time, and the history of opioid use. Belbuca, on the other hand, the available dosages are much lower. These ranges are in the micrograms and not in milligrams. So it starts at 75 micrograms and goes all the way up to 900 micrograms, which is right under 1 milligram. The dosing schedule is usually once a day or twice a day, which is typical for maintaining pain control. Now, the abuse deterrent is the most major difference between these two. Suboxone, of course, contains an naloxone component that acts as an abuse deterrent, particularly against IV use. So if injected, naloxone will actually induce withdrawal symptoms in an opioid-dependent individual, which hopefully curbs the abuse. While Belbuca lacks naloxone, the buccal film itself makes it less likely to be abused compared to actual other opioids. Now, regulatory status is about the same for these medications. Both are classified as Schedule III drugs, which means they have a potential for abuse, but this is actually less than the Schedule II drugs that we know of, like oxycodone, Percocet, Norco. Insurance and cost, of course, is going to vary by region, location, and the indication for use, as spoken of before, because Suboxone might be more readily available for addiction, while Belbuca is more readily available under the pain management provisions. Both Suboxone and Belbuca are great medications with distinctly different purposes. It's always best to speak with your healthcare professional to help determine what is the most appropriate medication for your specific needs.